So, minimally invasive spine surgery, or MIS, is basically a surgical approach that uses smaller incisions and specialized instruments to access the spine. This helps in minimizing tissue damage and, potentially leads to a faster recovery. Compared to traditional open spine surgery, MIS can offer benefits like less pain, reduced scarring, and a quicker return to activity. Some key aspects of MIS include the use of smaller incisions. MIS utilizes smaller incisions compared to the longer incisions of traditional open surgery. Specialized instruments are another important part. Surgeons use instruments like tubular retractors to create a tunnel to the spine, which allows them to work on the affected area without extensive tissue dissection. Technological advancements really play a big role too. MIS often involves the use of operating microscopes, high-resolution cameras, and computer-assisted guidance to enhance precision. With minimally invasive spine surgery, the smaller incisions and specialized instruments really help reduce the amount of soft tissue manipulation. This often means, less pain, less scarring, and a faster recovery for patients. Some minimally invasive spine surgery procedures can actually be performed on an outpatient basis, which helps reduce the length of your hospital stay. Minimally invasive spine surgery can be used to treat a variety of spinal conditions, including herniated discs, spinal stenosis, and even spinal fusion procedures. One of the key benefits of minimally invasive spine surgery is reduced pain. With less tissue manipulation during the procedure, patients typically experience less pain after surgery. Another important advantage is, a faster recovery. Patients can often get back to their normal activities much sooner after minimally invasive spine surgery. And, smaller scars are also a benefit. The smaller incisions used in this approach usually mean less noticeable scarring for patients. So, one of the big advantages here is a reduced risk of complications. With less tissue damage and smaller incisions, the chances of infection and other complications can really go down. Another thing to note is that some minimally invasive spine surgery procedures can actually be performed as outpatient procedures. That means you might not need to stay in the hospital as long, which is definitely a plus. Of course, like with any surgery, there are still some risks involved with minimally invasive spine surgery. These can include things like infection, bleeding, nerve damage, and even the possibility of non-union, which is when the bones don't fuse properly in spinal fusion procedures. So, it's really important to have a thorough discussion with your surgeon about these risks before you decide to go ahead with minimally invasive spine surgery.